Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning, and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, Chairman of Medicine at University of Louisville Department of Medicine, and we are very pleased that today for our Grand Round speaker to have Dr. Daniel Dumesic, who is Professor of Reproductive Endocrinology and Infertility at UCLA. And he gave a wonderful presentation on the incidence, pathophysiology, and management of Polycystic Ovarian Syndrome. And Dr. Dumesic, can you summarize this for us in a minute?
Well, I certainly will, and thank you for the invitation. It's been a pleasure to be here and talk with your group today. The idea that polycystic ovary syndrome is a combination of androgen excess, menstrual irregularity, and polycystic ovaries is very, very important. And knowing how to distinguish the various phenotypes is very important, with the most severe form being the combination of androgen excess and ovulatory dysfunction. The reason is that these people have an increased risk of insulin resistance, which is independent and additive to that of obesity. The recent literature suggests that letrozole is the new replacement for first-line therapy for ovulation induction, that the new ultrasound technologies have changed the number of follicles to define a polycystic ovary syndrome as greater than 20 follicles per ovary is a recent change. And the introduction on a medical aspect of some of the new GLP-1 receptor agonists is promising. In the future, although in the area of reproductive endocrinology, we're still struggling with obesity as a risk factor for miscarriage and lower pregnancy rates through in vitro fertilization. So we have a lot to go in terms of preventing obesity in all women, including those with polycystic ovary syndrome.
Well, thank you very much. This is very informative, and we really do have to do whatever we can to stem the tide of obesity in our country with all of its metabolic consequences. And thank you very much. This has been a Cardinal Minute.
Thank you.